I I use maternal mental health. I use that all the time, and that's how I explain what I do. And that is just the psychological well-being during pregnancy and up to 18 to 24 months after giving birth. So a lot of people think that postpartum and maternal mental health ends at 6 weeks after the baby's born, but I'm referring to pregnancy and up to 18 to 24 months after giving birth. All right, so also interchangeable perinatal. That's basically the same thing. Maternal mental health, perinatal mental health, pregnancy, post loss, postpartum, within baby's first year of life, and then postpartum is after pregnancy. So, um, talking about language, perinatal mood and anxiety disorders. They used to use that term and is usually would be called PMADs, but because of the research, they have changed that to perinatal mental health disorders. So that's a language that I'm using now. And then I've also recently learned about the perinatal emotional complications, and that is specific to the word complications. Align really well with the wording from providers and doctors. So you'll hear a lot of different things. So also people who identify with pregnancy and parenting can be affected by mental health conditions during the perinatal period, regardless of gender, sex, or sexual orientation. I just want to say all these things. And if I need to clarify, please let me know. So again, I'm so happy that y'all are spending this hour here. Why is this conversation so important? Well, did you know that there is a health there's a state report card for maternal mental health, and in 2023, so we usually, like, in 2024, like this year, we will get the previous year because they haven't collected all the data and research from 2024. So in 2023, I hope that y'all can see, this is, the US, and I think the highest score was a C, or no, I say a B. So our state, we got an F. So these are just the reasons why we did fail this report card. So this is why this conversation is very important to have. Oh. Okay, and other stats, up to 1 in 5 of those who are pregnant in the postpartum period will suffer from a maternal mental health disorder like postpartum depression. Less than 15% receive treatment. Can y'all believe that? Maternal depression occurs as frequently during the pregnancy as it does during the postpartum period. And up to 56% of those living in poverty experience postpartum depression. Those numbers are mind-blowing to me. Untreated maternal mental health disorders are estimated to have an annual economic cost of $14.2 billion, and more than 600,000 will suffer from a maternal mental health disorder in the US every year. Gen Z is more than twice as likely as boomers to suffer from a mental health disorder, and rates of depression are more than doubled in the Black population due to cumulative effects of stress called weathering. And this data is from Policy Center for Maternal Mental Health. So also, I'm so into this work that it's easy to for me to know that there are different types of specialties within this population. So whenever you think of postpartum mental health or postpartum depression or maternal mental health, I want to point out that while it's a very general and broad, and there are a lot of gaps and needs to fill that you usually won't see them with different specialties, but there are specialties within the perinatal population, pregnancy loss, addressing racial disparities, researcher, post-abortion loss, female and male issues, couples counseling, and then in the perinatal mental health disorders, some clinicians will specialize in one more than the other. Now, with me, with being a clinician, I specialize in postpartum anxiety and depression, but when I have clients who have these, there's a need, I will take, I will, get them support and therapy what they need. So it's really broken down, even though it seems like a very general topic. Um, all right, so some statistics. It blows my mind how little research we have in 2024, but we're getting closer to getting more research, and there are current research studies going on. I almost include them in this PowerPoint, but I felt like that was just a lot of information. So around 70 to 80% of new parents experience mood swings and feelings of being emotionally and physically overwhelmed after having a baby. Perinatal mental health symptoms are very common. Depression is considered the most common complication associated with childbirth. Perinatal mental health disorders affects at least 1 in 5 women, and then 1 in 10 fathers. That's very important to note as well, that it's not just the birthing individual who are affected by mental health disorders. Women of color are 3 to 4 times more likely to experience complications during pregnancy and childbirth and die from these complications than white women. And I just threw it, the 75% of women remain untreated. That's a big number. These mental health statistics, I just want to point out that the birthing individuals are not to blame or at fault for experiencing the mental health conditions. It's not necessarily brought on by anything a person has or has not done. Perinatal mental health disorders, they occur in people in every culture, age, income level, ethnicity. And then treating these mental health conditions may help prevent long-term and adverse effects for parents, children, and families. All right, so I'm gonna look in the chat real quick. Does anybody have any questions? Maternity care coordinator in Pike County. Oh yeah, okay. All right, Barbara. All right, so just want to check, make sure. Okay, so perinatal mental health disorders. I think the most common one this is not a disorder, a mental health disorder, but the most common talked about symptom are baby blues. In the next slide, I'll distinguish, but these mental health disorders range from perinatal depression, perinatal anxiety and panic disorders. You have obsession compulsive disorders, post-traumatic stress disorders, perinatal bipolar disorder and postpartum mania, postpartum psychosis, perinatal substance use, parental suicide, and complicated grief after perinatal loss. So if you're in the mental health world or you work in that type of environment, some of these are probably familiar, right? So you think of, let's just take OCD, for example. You may think of it like, we have to turn a light switch on 10 times or whatever. When it's with perinatal mental health, these obsessive compulsive disorders are going to be things that like protect the baby or will stop the baby from getting sick and things of that nature. So think of these diagnoses in a way that is molded to being a parent. So it's not so general, it's specific. So, all right. So I gave you a little rundown of the diagnoses or the conditions. So I did think it was important to also, disclaimer, I created these slides and then I found this beautiful PDF, and I actually want to share if anybody's interested, share these with you. So I took a screenshot and I put it on the bottom because these are way better than what I created. So, maternal mental health, these conditions are caused by a combination of biopsychosocial factors. So you have the biological, you have the hormones during pregnancy and in the immediate postpartum period, and that is a significant impact on mood. Then you have the psychological, Some individuals struggle with changes in roles, relationships, and responsibilities that come with the transition to parenthood. And then social. The childbearing years often include changes in jobs, homes, and finances that can add stress. External factors such as isolation during the pandemic can add or increase feelings of anxiety and depression. And also, it's important to talk about racial and cultural considerations. As I mentioned before, women of color are 3 to 4 times more likely to experience complications during pregnancy and childbirth and die from the complications. Intergenerational trauma. Black women enter pregnancy and childbirth suffering the impacts of intergenerational trauma, including the knowledge that many OBGYN procedures were tested on Black women without their consent and without pain medication. And then institutional racism. Institutional racism in healthcare contributes to Black women receiving lower quality of care, such as giving birth in lower quality hospitals, as well as being subject to dangerous, demeaning, or humiliating treatment. So those diagnoses that I showed earlier, I just combined all the risk factors because they were pretty similar, just a small difference. But there are risk factors to developing or experiencing a maternal mental health disorder. So some risk factors include a personal or family history of depression, anxiety, or perinatal depression. So we do ask about any diagnosis before being pregnant or having your baby, because those are definitely indicators. They could be indicators for experiencing for postpartum depression, anxiety, those disorders. Premenstrual dysphoric disorder, inadequate support and caring for the baby, financial stress, marital stress, complications in pregnancy, birth, or breastfeeding. If there was a major recent life event, so lost your job, you moved houses, or where you're living, or in a general loss. If you have multiples, so and then infants, children who visit NICU, infertility treatments, thyroid imbalance, diabetes, gestational diabetes, or any previous traumas. So those are the cumulative risk factors for the experiencing a mental health disorder. So in addition to these risk factors, there's a high stress parenting group, and this is another risk factor. And these can be queer and trans families, military families, teen parents, multiples, single parents, parents of color, near miss survivor, which is close to loss of life or limb loss, and then caring for a child or children with disability. Okay, that's good. All right, so quickly, I'm just gonna go over these. I feel like each one of these could be a separate type of training, but a lot of people will talk about baby blues, and those are feelings of sadness after you've had the baby, and the biggest thing to remember about baby blues is that usually resolves whatever the symptoms are the person's having. They'll resolve without treatment within 2 to 3 weeks of childbirth. The symptoms are emotional sensitivity, feelings of overwhelm, weepiness, right? Like you just brought a life into, or you just had a traumatic experience, whatever that is, like you went through a lot. So that is to be expected. And it's likely associated with significant changes in hormones. If you have, or if your clients talk about having sad feelings that last longer than 2 weeks, recommend that they talk to their provider. It's important to have that conversation to create a treatment plan. So we have the most commonly talked about perinatal depression, feelings of anger or irritability and rage. And so there's lack of interest in the baby, appetite and sleep disturbance, crying and sadness. There's feelings of guilt, shame, or hopelessness. There's loss of interest, joy, or pleasure in the things that you used to enjoy, and possibly intrusive thoughts, possible thoughts of harming the baby or yourself. So the next one is perinatal anxiety. So the symptoms of anxiety during the perinatal period might include constant worry, panic attacks, feeling that something bad is going to happen, fear of going outside. You have racing thoughts, feeling of overwhelm. Again, disturbances of sleep and appetite, the inability to sit still, and you can have physical symptoms, dizziness, hot flashes, nausea as well. So postpartum post-traumatic stress disorder. So postpartum PTSD is caused by a perceived or real trauma during delivery or postpartum. The thing about that I stress about PTSD in postpartum is that the person is really the only person who can, I guess, dictate what that trauma is. What happened to me, what could happen to me, I could deal with or respond to differently than someone else who had the same experience. So that's why I say perceived. Like, it may not be a trauma. Someone may be talking to you about something, and it may not seem like a trauma, but to this person, it was a lived experience that felt like trauma to them. So these symptoms are intrusive. They can be intrusive re-experiencing of a past traumatic event, usually childbirth itself, that can result in flashbacks or nightmares, changing cognition, mood, typically around childbirth, avoidance of stimuli associated with the event, including thoughts and feelings, people, places, and details of the event. Whether that's childbirth, whether that was a treatment they received in the hospital or lack of treatment, or a lot of things. Another thing that's common is the provider or someone not believing the person when they say they're in pain. So it ranges on the type of experience this person could have. They're feeling like they're constantly on guard. They have anxiety and panic attacks, and they could get a feeling of a sense of unreality and detachment. All right, so perinatal obsessive compulsive disorder, it's characterized by repetitive, unwanted, intrusive thoughts, so obsessions, and irrational, excessive urges to do certain actions. So that's where the compulsions come in. These are frightening, intrusive images and anxious in nature with a very low risk of being acted upon. So in perinatal OCD, individuals may have these obsessions or compulsions to avoid something from happening to them or their child, or a trigger. So these symptoms, obsessions called intrusive thoughts, which are persistent, repetitive thoughts or mental images related to the baby. So I'll tell some clients, I'll explain that the difference between which I'm not great at saying this word, dystonic or systonic, that to help like provide comfort in, this does not relate with your values. This is something that is unfamiliar to you and you do not agree with it. These are just intrusive thoughts. So they could have compulsive behavior. So constantly cleaning, checking things multiple times, counting things, reordering things, with a sense of horror about these obsessions. So they're not, they do not want to experience these things. And someone could be hyper vigilant in protecting the infant. So that's how these symptoms appear. So bipolar mood disorders, two phases of a bipolar mood disorder, the lows and the highs. The low is clinically called depression, and the high is called mania or hypomania. And There are periods of severely depressed mood and irritability, unusual shifts in the mood, energy and ability to carry out day-to-day tasks. There's rapid speech, little need for sleep, racing thoughts, with trouble concentrating, high energy, all the continuously, possible delusions, impulsiveness, poor judgment, distractibility, grandiose thoughts, and in most severe cases, delusions and hallucinations. There is an increased risk for postpartum depression and psychosis in women with bipolar disorder, and are vulnerable to reoccurrence during pregnancy. So that's definitely a risk factor to with the diagnosis beforehand. All right, so I think recently, I say recently, like to me, like within the past year, this has really been talked about a lot more, perinatal psychosis. So um, if you are experiencing a client in perinatal psychosis, that is considered an emergency. So it would be one of those things where, if someone could get to a hospital, inpatient, to their doctor, that is the first step. If there are challenges to doing that, it's recommended to not leave the mom alone. So is there somebody who can be with the baby, just providing that extra support, or child. And this is the most significant disorder, but it's the least frequent mental health condition. And within postpartum or perinatal psychosis, there is an increased risk of suicide or infanticide. So this onsets within 1 to 2 weeks following childbirth, and these thoughts are ego syntonic, where there's a break from reality and they fully believe what they're hearing or seeing. So these symptoms: delusions, hallucinations, paranoia, rapid mood swings, cognitive impairment, irritated, hyperactivity, reckless behavior, and focusing on death and difficulty communicating at times. So this is a very urgent situation. I've also used if a client or somebody cannot complete a form or a PHQ-9 or some sort of assessment tool, then that's going to be your sign of, okay, let's investigate this a little bit further. So perinatal psychosis is treatable. It's considered an emergency. So contact your doctor or the client's doctor at an emergency crisis line immediately. And the mother should be taken to emergency room for assessment and care. And just because of the serious matter, I just wanted to include this information. And of course, I can get this to y'all for sure. But it's an emergency. It's something that needs to be attended to. All right, so I'm gonna look at the chat real quick. Just gonna, yes. Is there data on those two symptoms? Yeah. Okay. Yes. Great questions. Great questions. So in types of intrusive thoughts in OCD. So the one that immediately always comes to my mind, and they are great. I should have done a picture, but they are great images of these intrusive thoughts. So I'll just say an example, but I want to get you, in fact, actually, I deleted a slide that had that. I'm not going to do it because I'm sharing the screen, but yes. So intrusive thoughts and OCD. So, always the one that comes to my mind is I can't leave the house. My kid's going to get sick. I'm going to get sick, and I need to if anybody comes over, well, I don't know, with COVID or whatever, but wear a mask. I'm going to sanitize I'm gonna wash all the clothes. I'm gonna wipe down all the counters. I'm gonna do hand sanitizer and wash my hands. So things of that nature to protect. So like my baby's gonna get sick and die, right? Or like I'm gonna fall and hurt my baby. Um, things of that manner is, yeah, yes, Stephanie, there are resources. Leslie, does that help with just an initial types of intrusive thoughts? They're mostly going to be about like harm. Yeah, okay, yeah, and I'll make sure because there are good, and there are good. And I almost included a reel about like what it looks like um, for moms. Like another one is they think their baby will stop breathing at night, and so they go and check on the baby like as many times as they think they need to. Um, so I'm just writing down to send. Um, okay, and then Stephanie, there are resources. I'll share those for sure. And there's one more. Yes, Felicia, that's a great question. And I deleted that slide too because I was like, yes. But yes, doulas, midwives, lactation consultants, they do have better outcomes or improved outcomes um, if they're included in the plan, right? And I can get those specifics to you, but it's a lot of support being provided and connecting versus isolation and not being able to have access to care. And especially with having telehealth as well. So yeah, and not to mention the maternal care desert. So like that's a doulas and midwives are definitely can be accessed. Man, you're asking the question. I shouldn't have deleted these. I'll also send that information. That's great. Um, okay. All right. Oh, oh, oh God. Okay, here we go. Let's see. Here we are. Okay. So we've quickly covered those mental health, perinatal mental health disorders, and within the DSM, I was kind of blown away. That's why I put this entire paragraph at the bottom. But major depressive disorder with postpartum onset wasn't recognized in the DSM until the publication in 1994. So, so when we're looking at the DSM, the only thing now this is, I need to continue this research because I'm very intrigued, but the only thing added is a specifier with postpartum onset, defined as within 4 weeks of delivering a child. Now, from what I read, PSI, Postpartum Support International, they advocated for them to add the specifier within like anxiety disorders. And they also wanted to change 4 weeks to 6 months of delivering a child because we know it lasts longer, it can be onset longer than or past 4 weeks. So, but that's what you got. That's what we got. It's this specifier can be applied to major depressive disorder, manic or mixed episode of MDD, bipolar 1 disorder, bipolar 2 disorder, or to brief psychotic disorder. For anybody out there that works in or has to get files reimbursement with insurance, how I do that and with insurance is major depressive disorder specifier, but also if someone has come in and they've had the baby, what is it, 6 weeks, I had this in my notes, and they are experiencing anxiety, then I'll do generalized anxiety disorder. Also, I'll do adjustment disorder because if you think about it, they are adjusting to this new role, and I mean a lot of different things. So until I can figure out the exact diagnosis, that's what I do so I can continue to insurance to cover um, their sessions. So anyway, this is just a little. There's not much to report on the DSM-5, but this is. I just felt I feel like I need to be formal with this. I just wanted to include this table for MDD. And then peripartum onset specifier onset of symptoms occurs during pregnancy or within 4 weeks after childbirth. Okay. Okay, so I know I'm going to kind of run through these things. These are the most important things, but there are screening tools, evidence-based screening tools, and the benefits of these are that they can be self-administered. They are translated into many languages, and that they are easy to complete. So it just takes a few minutes for individuals. So you have the Edinburgh Postnatal Depression Scale. And it's just going to ask 10 questions. If they score above 12, they are likely suffering from depression and should seek medical attention. It takes less than 5 minutes. The other one, probably the most familiar one, is the PHQ-9. It's just a good entry, like breaking the ice a little bit with doing some assessments when you're establishing rapport. It doesn't really identify like the anxiety part of it, but this does get to see where they, in the past 2 weeks, how often they've been bothered by the following problems. It gives some more insight, and you can use this. This is helpful. I use a screener with clients initially, and then there's one other perinatal anxiety screening scale pass. This is learning about anxiety, how like the forms of anxiety, just learning a lot, getting more information, anxiety specifically. So those are 3 you can choose from. Barriers to mental health care. Y'all probably really familiar with these. Stigma on mental health. A lot of moms or birthing individuals experience shame and guilt. There is inadequate access to care and screening. There are limited access to healthcare services. So there's also lack of systemic support from community or healthcare systems. There's a disconnect from providers. There's a lack of diverse providers, who are culturally competent. And providers are also, they're worried about screening because there are not enough clinicians to support the birthing individual. And also, I'm a social worker, so I want to mention the social determinants of health. Stable housing, food security, financial resources, and other social supports. And then these gaps, they're felt disproportionately by communities of color. Okay. All right. So earlier, I kind of started the conversation with intersectionality, and I'm going to bring that. If you're unfamiliar, Kimberly Crenshaw coined this term in 1989. I mean, that's not that long ago. Describing how race, class, gender, and other individual characteristics intersect with one another and overlap. And so intersectionality is just a lens through which you can see where power comes and collides, where it locks and intersects. It's the acknowledgement that everyone has their own unique experiences of discrimination and privilege. And so I bring this here because when I introduced myself, I could have added a lot more in there. But what I want you to think about is wherever you are working or whoever you engage with, they're not just a mom, right? Or if that's how they got introduced to you, just because we're having this perinatal conversation, that's who I'm gonna assume that we're talking to. But up here on the left, my left, is I've added things that's specific to postpartum and perinatal things, right? So you have a different experience with mental health and all of these things. And if your baby went to the NICU, if you were able to breastfeed or not, and then also with breastfeeding, how supported were you? Were you were you discriminated? Were you told to, there's a lot of experience that come with that. Birthing complications, birth trauma, race, socioeconomic status. So what I'd like to do with this is just like, when you think about your clients, close your eyes and you can think about these things and see that this is not just one problem or thing that they're dealing with when they come to see you. These are a lot of experiences they will not share with, probably not share with you, but these are affecting a lot of things in their life, right? Access, choices, things of that nature. So I think it's just really important to bring this to the table when you think about perinatal mental health. And then, of course, the social determinants of health, education, access, and quality, healthcare and quality, neighborhood and built environment, social and community context, economic stability. All right. So when I thought about interventions, not only did I think about the screening tools, clinically, but I broke it down in a way that my brain worked, how it works, honestly, how it works with this population. So we're all social workers here. We know what micro, meso, macro mean. So in micro and meso interventions, I just want to give some suggestions in the comments. If y'all have more, please put them there. I want to add it to future presentations and just my knowledge. But social support, no matter if you're in micro, meso, social support, right? Compassion, providing self-care and realistic resources to your client. I love eco maps when I'm engaging and learning about a mom or a birthing individual, because I can collect data and learn their support systems and remember the names of all of their kids or their spouses or whatever. So eco maps, I love utilizing those. Identify local resources. So my mind goes to wherever you are and supporting, wherever you work or volunteer or whatever, when you're supporting new parents or parents and their families, think about the intersectionality, right? Think about maybe they have a child with a disability. Think about Easter seals. Like, are you familiar with state and federal resources that could alleviate some pressure or alleviate some stress in one area? So identify local resources and federal and state resources. Let me put that in there. Mental health support, like referrals, case management. You can that's there, and support groups. Support connection is the way to go. Yeah, like I said, identify and connect to resources, resource centers, Easter seals, area agency on aging. I mean, there are resources that aren't typically thought of, but that could really help. They have programs to help parents. And then, if you have a resource guide within wherever you are, create it, update it, enhance it to include resources to support moms and their families, or birthing parents and their families. Macro interventions, which I love, macro policy, advocacy, right? Focus groups, if that's what you're into. That's how I've learned some things. A needs assessment, grant writing, eco maps again, networking, and just like micro, meso, and macro, they're overlapping, right? Same with these interventions. You can provide these at each level as well. So clinical, and then I broke it down to clinical because here we go, but I'll go quick. CBT, cognitive behavioral therapy, interpersonal psychotherapy, exposure and response prevention, dialectical behavior therapy, eye movement desensitization and reprocessing, talk therapy. So I talk a lot with moms or like narrative stories about their birth story, their postpartum experience, their breastfeeding support. Um, I don't, I haven't utilized. I'd love to learn more about brain spotting. There's inner child work that comes up a lot. And then there are intensive treatment facilities and intensive outpatient programs. So as y'all know that it's good to get your client to, if they haven't been to a provider, um, have them go to a provider, get a medical evaluation, just to rule out anything else that could be going on besides a mental health disorder. Um, antidepressants antidepressants are the most commonly used medication to treat depression. And I always will ask clients, have you gone to the doctor and checked your thyroid? Because postpartum thyroidism can create similar mental health symptoms. And then there is a new drug out there. It's an um, oral drug, oral medication, FDA approved. I have no idea how to say this. So, um, Zurzuvae. It's a prescription medication. It came out in last year. Um, I always refer people to their doctor to talk about medications. So I just want to throw that out there. This is the first oral medication approved. The other, I can't remember what it was, but you had to be hospitalized to get it because it was not an oral medication. Okay. I'm gonna, just for a second time, this is super important, but I'm gonna send out handouts y'all can, and it will look great. There are consequences of untreated maternal mental health conditions, on mothers, on children, on parents. Yeah, I'll send that to y'all. If we have time, I'll come back to it, but I just want to respect everybody's night. Also, I want to include, because I'm a big advocate for breastfeeding, or now terminology is chest feeding. There are positive effects. So it creates bonding, it boosts your confidence in parenting skills. You have enhanced mental health support if you, by exclusively feeding 6 months to a year. And if you have enough supply and have that support at work and at home. There's a chemical released oxytocin. It can cause you to feel less stress and promote a state of calm. And again, it helps you bond with your baby. But there are also negative effects of breastfeeding, which sounds wild, but it does happen. It's if you wanted to breastfeed but you can't for whatever reason, it can definitely have a negative impact or effect on your mental health. Also, some breastfeeding parents deal with a state of intense dysphoria immediately after breastfeeding. So when the baby's done eating and latches, it's called dysphoric milk ejection reflex. And it's characterized by general just unhappiness, uneasiness, and frustration. It goes away pretty soon, after you're done feeding, but that does happen. So to continue to support breastfeeding, and this is new as well, with the logo change, but in 2018, me and a colleague founded T-Town Tots, which is a breastfeeding support service to provide a safe space on the quad for Alabama home football games. And we are rebranding, and this is going to be our new logo and name. So if you see T-Town Tots, we are one. We are the same. So we'll be. You follow us on social media just to stay updated with when we're going to be out there. We usually don't set up if it's like an 11 o'clock game, just because the moms and babies are not really out there that early. So we're out there 4 hours before game time, and then we pack up 1 hour before game time. So if you know moms who are looking for support here, and we changed this logo, we wanted to be more inclusive so that way we can spread out to other places in the community. So we're excited about this. And then policy and advocacy, there's a lot more work being done by creation of the National Maternal Mental Health Hotline, and you'll hear that phrase, Mind the Gap. And then the Alabama Perinatal Quality Collaborative created the Alabama Maternal Health Task Force to expand and improve maternal mental health. across the state. So UAB is leading that here in Alabama. Medicaid expansion, and then the overturning of Roe versus Wade. So these are just like some policies and some parts of advocacy. SAMHSA and 2020 Mom, which is now the Policy Center, and Chamber of Mothers. Those are just some examples of places to get you started. And then because I'm a certified financial social worker, I did, there's not a lot, I didn't include a lot of data because that's not where this conversation was going, but I did want to include it because this is part of that holistic support, right? So, according to Mathematica, the cost of not treating maternal mental health conditions is 32,000 per month mother-infant pairs, or 14 billion each year in the U.S. And then, just to again ride the train of supporting breastfeeding, according to experts in 2022, families could save around $1,200 in a year if they were exclusively breastfeeding, if they were able to breastfeed. So, there's just some of that. If y'all are interested in any of financial social work stuff, check us out. The Financial Social Work Collaborative, co-founder, and I'd love to do some more work with financial social work in the perinatal community. So, what can you and your community do? I'm also a climb leader. So every June, and now they've added October, there's an event called The Climb, and it's really to raise awareness and funds for maternal mental health disorders. So if you're in Tuscaloosa, I have one every June. This will be my fourth year next year. So let me know if you want to be involved. I'm always needing help with that. You can volunteer with PSI, Postpartum Support International. I have not done this yet, but I'd love to have a data party, and that's a whole nother conversation for a different day. But it's basically sharing statistics and data, and working together to form support. Start having conversations like these, vote, and then also reach out to me. I'm looking to collaborate in any way. So these are some resources. I forgot to make it all look clean, so sorry about that. Postpartum Support International is the powerhouse of resources. I hand stuff out to new clients, that takes stuff everywhere. Postpartum support, there's an Alabama chapter. They have a provider directory. They have medical provider training. They have an online directory. And they have free online peer support groups. They have The Climb. They have a consultation line. So if a medical professional has questions about mental health care related to pregnant and postpartum patients, they can call this line and talk to an expert. And then there is an upcoming professional training. So foundations in paternal perinatal mental health. I just want to include that because I feel like a lot of times people leave out the other partner. So there's that if you're interested in that type of training. PSI, Postpartum Support International, they have an app. So makes things so much easier to access resources. Maternal Mental Health Leadership Alliance, that's where I'm sending some of these PDFs from. They are amazing with gathering this information. They just have so much information. The Policy Center, which was 2020 Mom, and then the MGH Center, so that's Women's Mental Health Reproductive Psychiatry Resource and Information Center. So MGH Center, every Wednesday they have rounds, and so they have doctors and reproductive psychiatrists in there, and they are going over cases, and they send a lot of information. So make sure you follow them. Maybe start going to those. They're every Wednesday. Okay, and then last but not least, sorry, I know we're here. Again, this is the party that rebranded and my business, and in hopes to increase access to postpartum health and wellness support through community education, products, and advocacy. So we are located in Tuscaloosa. So we are in the process of creating resource guides and services and support for West Alabama. And yeah, so I don't know if the QR codes will work. The website I was supposed to release today, but I'll have to do it tomorrow. But follow me on Instagram if you have any questions, want to collaborate. That's and their references. Okay. All right. So just 2 minutes over. Not
All
bad. Let
right.
me stop sharing.
That was great information. We want to give a round of applause for LB. This is very informative. I didn't, it's really interesting how many specialties are out there for different problems and different challenges that we have in every area of life. And a lot of times until it's brought to you, you don't really know of all the resources that are available and that's out there. So we appreciate you, bringing us expertise on this. And my understanding is, and this is, because I'm always looking for places to refer, is that where um, you provide psychotherapy services, and is that more exclusively to individuals that are experiencing perinatal concerns relative to what you've been talking about tonight? Is that correct?
Yeah, yeah, absolutely. I do that. I do virtual. I do in person in the state of Alabama.
Okay.
Well, in Tuscaloosa, but virtually in the state of Alabama. And there is a discussion tool that's a great thing that you can give to somebody, and you can really get some information of where they're needing support in, because I mean it just ranges just because of all of the things that compound and experiences that it just ranges. So but yeah, so
Okay.
and sometimes things start out as like, oh, I just I had a baby, or like my husband, my partner thinks there's something wrong. I don't know. Like I've had partners with consent, call and set up appointments. So yeah, so it's specific to um perinatal mental health in having a baby or losing a pregnancy or adoption and things of that nature.
And one other question too. Now you said that there was a resource I think that you showed, and I think I took a picture of it. But they have groups that are there's no charge for the groups for
Yeah,
individuals. They have
it is.
that.
Oh my God. Can I
Wow.
share my screen and show
Please,
you?
please show that
Okay.
again. Yeah, I want to make sure I
All
get
right.
that.
Yes.
And I'm
So
sure some others would like to have that as
yeah,
well.
so I'm gonna do everyone. So all you have to do, so I'm gonna put in the chat. I give this out like when I like if anybody is interested in services, I make sure to either print them or I send them in an email of resources. These I'm gonna pull it up and share my screen, but they literally have virtual support groups for everything and everybody. So
Wow.
let you see how excited I'm getting. Like
Yeah, I get pumped up about that too, because it's so hard to get resources,
it is
uh,
so hard.
especially free ones, and you have your people that's really in need of help. So
Yeah,
when I
and
saw that, I said I need to bring that, and we're gonna let y'all go if you have to go. I understand if you have to leave, but I wanted to make sure that we highlighted these free resources that are available for our people
yes.
that
Oh
are
my gosh. Yes,
yes.
please. And in fact,
Is
within
it
my
is your okay, there it goes. It's about to share. Okay, good, good. Let me
so
write this
within
down.
one of the things that we do within the business is create apparel and products. And one of the things I've done with onesies or shirts, really like any type of clothing, I put the QR code for this website. So that way, in my mind, it's like if somebody is struggling at 2 a.m., scan the code and you can at least figure out. So from Jump, get help, call this line. They have a helpline. And so
Wow.
get help and online. So, and your mind's gonna be blown because and just give my computer some grace here. All right, so check it out. I mean, ADHD support for pregnant, postpartum,
Oh
bipolar
wow.
support, birth mom support group, birth trauma support birth trauma for Black and Indigenous people of color, BIPOC. You can connect, dad support group, early pregnancy loss, fertility challenges. Like check it, like military, NICU. Like look at all of this, and they have
Wow.
things and they have literature in Spanish. You can order things. Some of them are free to or I mean it is amazing, and that's why I'm so heavily involved with Postpartum Support International, because they are, I mean, they're always looking for volunteers, but, and, any professional services, resources, so yeah, I mean, it's amazing. I mean, it's just so much good work being done.
Thank you so much. Thank you so much, LB. This has been very, very informative, and we're just glad that you were able to share this information with our group. And I just want to thank you all again for joining and being a supporter of Social Workers of Alabama and the training that we provide. We're gonna go on and let you all go. Keep a heads up. We're gonna try to get those CUs out to you within the next couple of days. If you haven't received it by end of Friday, please reach out because there's a problem. If you have any problems, upload it. Please feel free to reach out to me because we want to make sure you get these CUs. And we're gonna let you all go tonight. We will have
Yes.
something for next month. I don't have the information up, but we'll get that, and that'll be in Social Workers of Alabama. All right.
And thank y'all for having me. Thank y'all for spending your Tuesday night here. I'm so excited.
Yes. Goodbye. Thank you.
See ya.